I'm Dr. David Hill, and today we're going to be talking about how to deal with seizures in older children. Now, a seizure affects about 1 in 250 children on average. Some seizures are associated with fever and only occur with fever, but these seizures, called febrile seizures, occur in children between the ages of 6 months and 6 years. So if we're talking about a child who's more than 6 years old, it's probably not a febrile seizure that we're looking at. When a child has a seizure, it can manifest in a lot of ways. Some are very subtle. They may just be staring spells or a moment of inattention. They may be a single jerk that involves the entire body. But the most classic type of seizure, called a tonic-clonic seizure, involves a repetitive jerking movement of the entire body, arms and legs included, often with a loss of bladder or bowel control as well. Now, when you see this as a parent, it's a very, very frightening episode. Always. However, there are some things you can do to keep your child safe, and there are some guidelines about when to get really worried. Most importantly, if your child is having a seizure, you want him or her in a safe place. That is the ground. So you want to get your child somewhere that he or she is stable. And now, if they're in a bunk bed on the top bunk, try and keep them there. Don't try and lift them down to the ground unless you think you can do that real easily. But you want your child somewhere stable. Next, body position. You want to roll your child so that he or she is on his or her side or tummy. That way, if they're gagging or if they're choking or vomiting, that fluid or whatever's in their mouth is not going to go in their airway. Likewise, you want to make sure that there's nothing in the airway that the child can gag or choke on. So if they were eating or having chewing gum, you might just do a quick airway sweep to make sure that they're not going to choke or gag. Now, things not to do. Do not try and insert something in the child's mouth. That's unnecessary and it can cause injury. Also, don't try and hold the child's tongue. Sometimes he or she will bite the tongue, but children cannot physiologically swallow their tongue. That's an old wives' tale. Don't get worried about that. It will not happen. Now that you've got your child in a safe and secure position, you want to make sure you know how long the seizure is going on. And this is really hard to do because you're going to be freaking out. But look at your watch, look at a clock, see when the seizure started. If it's going on more than 10 minutes, you need to call emergency medical services. For a seizure that lasts less than 10 minutes, you can carry your child to the hospital or to his doctor's office. You've got a little time to get some advice and figure out what's going on. But for a seizure over 10 minutes, you're going to want EMS to report because they have some ways that they can stop the seizures and take care of the child, as well as transport him or her to a medical facility if they feel that's necessary. Now, if your child has already had seizures in the past, you probably have a kit called Diastat. This is a form of Valium or benzodiazepine that you can actually inject into the rectum to stop the seizure. You should have gotten some instruction when you got that kit on how to use it from the pharmacist or from an online site or a DVD that came with the kit. So hopefully, if you have one of those, be sure that you've seen how you're supposed to use it before you need it so that you're ready when the time comes. Talking about how to manage a seizure in an older child, I am Dr. David Hill.